Disclaimer. This podcast is for educational purposes only and is not medical advice. Always talk with a qualified healthcare professional before starting peptides, supplements, or any new treatment. Today we are diving into a topic that a lot of people are curious about but rarely feel comfortable discussing openly. Sexual performance. Whether you're a man or a woman, sexual health is a real part of overall wellness, confidence, hormones, mood, and connection. And peptides have become one of the most interesting tools people are using to support libido, arousal, energy, blood flow, and satisfaction. So today we're going to explore the peptides most commonly used for sexual performance, how they work, what people report feeling, and how they compare to traditional approaches. As always, this episode is here to educate you, empower you, and help you understand the landscape so you can make informed choices. Let's start with a big picture idea. Sexual function isn't just one thing. It's not just libido. It's not just blood flow. It's not just orgasm intensity. Sexual performance is actually a combination of several systems working together. Hormones, neurotransmitters, circulation, nerves, mood, confidence, and even energy levels. Because of that, peptides that help sexual performance usually work in one of three ways. Either they stimulate the brain's desire pathways, or they improve blood flow to sexual organs, or they support hormonal balance, recovery, and stress reduction. Some peptides do all three. That's why some people notice changes fast and others notice deeper long-term improvements. Let's start with one of the best-known peptides in this category, PT-141, also known as bremelanotide. This peptide works primarily on the brain, and that's what makes it unique. Instead of focusing on blood flow like medications such as Viagra, this peptide increases desire by activating melanocortin receptors related to arousal. In simple terms, it flips the switch in your brain that says, yes, I want this. Many men and many women report that PT-141 gives them a more natural sense of desire and interest. It's not a stimulant high. It's not mechanical. It's more like your brain wakes up and reconnects with that part of you that wants intimacy. People also report increased sensitivity, more intense orgasms, and a general feeling of warmth or connection. One interesting thing about PT-141 is how it works for both men and women. Many women who struggle with low desire find it helpful because it bypasses hormone issues. It talks directly to the brain pathways responsible for wanting intimacy. Many men say it helps with not just desire but also staying engaged mentally. That's something traditional medications don't address. They help the body but not the mind. PT-141 affects both. Now, let's talk about one of the hidden gems, kisspeptin. This peptide supports sexual function indirectly by improving hormonal signaling. Kisspeptin helps stimulate the hypothalamus and pituitary, which support testosterone, estrogen, and overall reproductive function. For men, this can mean better natural testosterone production, better mood, and more stable libido. For women, kisspeptin can help with hormone sensitivity, emotional connection, and improved natural lubrication. Many people notice that they feel more themselves sexually, not just more aroused, but more balanced, confident, and emotionally present. Another peptide that plays a powerful role in sexual performance is oxytocin, often called the bonding peptide. Most people think of oxytocin only in emotional terms. Warmth, closeness, trust, affection. But oxytocin also enhances sexual pleasure, sensitivity, and the intensity of orgasm. When oxytocin levels rise, both men and women usually feel more connected and more responsive. It reduces performance anxiety. It strengthens emotional engagement. It decreases the overthinking that sometimes gets in the way. It makes touch feel more meaningful. And that alone can improve performance dramatically. There are also blends that include oxytocin combined with other peptides to make the experience more physical and more emotional at the same time. Many couples use oxytocin because it helps them reconnect on both levels, the mind and the body. Now let's go into peptides that support blood flow. Because sexual performance isn't only about desire. For men especially, blood flow is critical. And for women, blood flow directly affects sensitivity, lubrication, and orgasm. One of the peptides being used for circulation is known as vasoactive intestinal peptide, or VIP. VIP can increase vasodilation and support improved blood flow to multiple areas, including sexual organs. People who use VIP describe a sense of warmth, fullness, and improved responsiveness. When paired with desire peptides, it can create a full-spectrum effect. Mental desire combines with physical readiness. Another peptide that indirectly supports sexual performance is GHKCU. This peptide is well known for skin, healing, and collagen, but it also increases nitric oxide. Nitric oxide is the same mechanism used by many blood flow medications. When nitric oxide increases, blood vessels relax and open. This can improve erection quality for men and increase sensitivity for women. GHKCU is not usually used alone for sexual benefits, but as part of a larger protocol it adds an impressive supportive effect. Let's shift into peptides that help with energy and recovery. Because sex is also about stamina and physical readiness. One of the peptides known for metabolic support and endurance is MOTS-c. People who use MOTS-c often say they feel more energy during the day, less fatigue, and better exercise performance. That improved stamina can absolutely spill over into sexual performance. If someone feels run down, inflamed, or exhausted, libido is usually the first thing to disappear. MOTS-c helps restore the underlying energy that makes sex feel exciting rather than tiring. Another peptide that supports overall sexual performance by reducing inflammation and improving emotional balance is Selank. Selank works on stress response. Many people struggle with libido because they're overwhelmed, anxious, burnout, or mentally distracted. Selank helps the mind relax without sedation. It helps people be more present, clearer, less stressed. A calmer mind means a more responsive body. When the brain isn't overwhelmed, sexual function improves naturally. The same goes for Cmax, which increases dopamine and focus. People often report more interest in intimacy simply because their brain feels more alive and motivated. Let's also talk about peptides that support sexual health through healing. One example is BPC-157. This peptide helps repair tissues, reduce inflammation, and support nerve function. For people who experience pelvic discomfort, painful intercourse, prostate inflammation, or recovery after injury, BPC-157 can make intimacy feel better again. Pain is one of the biggest killers of libido. When the body feels safe and healed, desire returns. Now, let's talk about the difference in what men report versus what women report when using sexual performance peptides. Men tend to notice physical improvements first. Things like better erection quality, more reliable performance, more stamina, and more confidence. Women tend to notice changes in desire, sensitivity, emotional openness, and satisfaction. Women are also more responsive to peptides that target the brain. That's why PT-141, oxytocin, and kisspeptin are extremely popular for women. One of the most interesting things people report is that peptides often lead to more natural, more connected intimacy. Not the artificial feeling that some medications can create. People say it feels like their own sexual drive coming back, rather than something mechanical being forced. That's one of the biggest advantages of peptides. Many of them enhance the natural pathways you already have instead of pushing the body into an unnatural state. Another important point is that sexual performance peptides can be tailored to the specific issue someone is experiencing. For example, for someone who has desire but struggles with blood flow, the approach is different from someone who has blood flow but struggles with desire. Someone who has emotional disconnection needs different support from someone who has hormonal imbalance. And someone who has pain needs different peptides than someone who has mental shutdown. That's why people often combine peptides to create a more complete effect. It's not about forcing the body. It's about restoring what may be missing. Let's walk through some example combinations that people commonly use. Someone who wants help with desire might use PT-141 and oxytocin. Someone who needs help with blood flow might use VIP or a nitric oxide boosting peptide. Someone who needs mental relaxation might use Selank before intimacy. Someone who needs better energy might use MOTS-c. Someone who needs hormone regulation might use kisspeptin or a peptide that supports GnRH signaling. And someone who feels emotionally disconnected might respond extremely well to oxytocin alone. Another thing people notice with these peptides is that they improve intimacy outside of the bedroom. Couples often report better communication, more affection, more closeness, better mood, and more willingness to initiate. When intimacy feels easier and more natural, relationships feel better overall. Many people say that peptides help them feel young again, confident again, or simply reconnected to that part of themselves that had gone quiet. Now, let's talk about dosing patterns in general terms. Not exact medical instructions, but common experiences. PT-141 is often used about an hour or two before intimacy, though some people feel it lasts into the next day. Oxytocin can be used shortly before intimacy or earlier in the day to create emotional softness. Kisspeptin is usually used in cycles to support hormones over time rather than for an immediate effect. Stress-reducing peptides like Selank can be used on days when mental tension is high. Energy peptides like MOTS-c are typically taken in the morning and indirectly benefit sexual stamina. BPC-157 is used daily for healing, which gradually supports comfort and sensation over time. There's another important factor to talk about: confidence. Sexual performance struggles often create mental loops. Worrying that something won't work. Feeling embarrassed. Feeling disconnected from your own body. Peptides can help interrupt those cycles because they support the underlying systems that restore natural confidence. When the body responds well, the mind relaxes. And when the mind relaxes, the body responds even better. It becomes a positive cycle again, instead of a negative one. Another surprising benefit people report is improved overall well-being. Many of these peptides support neurotransmitters like dopamine, serotonin, or oxytocin. That means people feel more motivated, happier, more emotionally open, and more connected to their partners. Sexual performance is rarely about just sex. It's about feeling good about yourself, feeling confident, feeling bonded, feeling energized. Peptides touch many of these systems at once, which makes the effects feel more natural and more comprehensive. Now, let's touch on something important. Not every peptide works the same for every person. The reason is that sexual function varies widely. Hormones, mental health, physical health, stress levels, medications, and relationship dynamics all play a role. Some people respond instantly to PT-141. Others need several doses before they feel a shift. Some women respond strongly to oxytocin, while others respond more to dopamine-based peptides like Cmax. Some men benefit more from blood flow support, and some couples benefit most when both partners use peptides together. The best approach is always individualized. Also remember that lifestyle plays a huge role. Sleep, stress, nutrition, hydration, exercise, and relationship health all impact sexual performance. Peptides aren't magic. They're tools that support natural processes. When combined with a healthier lifestyle, the results are often much stronger. Let's go deeper into the experience people report. PT-141 often produces a warm, anticipatory feeling, a mental shift where desire turns on. People describe it as feeling flirtier, more playful, more bold, or more responsive. Women often experience increased sensitivity and stronger orgasms. Men often experience stronger erections and more consistent performance. Oxytocin creates a softer emotional state, more affection, more trust, more closeness. It reduces the overthinking that can interfere with pleasure. Kisspeptin can make people feel hormonally balanced and emotionally steady. Selank and Cmax help with focus, relaxation, and mental readiness. MOTS-c improves endurance and physical stamina. VIP enhances circulation and responsiveness. And BPC-157 supports comfort and healing. When these effects are combined, the experience can feel more complete and more natural than using a traditional medication that only targets one pathway. Now, let's talk about safety considerations in a simple way. Peptides vary in their safety profiles, but most fall into the category of biologically natural compounds that the body already knows how to process. That doesn't mean they're without risk. It just means they're generally considered more gentle than synthetic drugs. The biggest issues usually involve dosing too high, using poor quality products, or not considering underlying health conditions. That's why talking with a professional is essential. But in general, many people find peptides to be easier on the body compared to traditional medications. Let's also talk briefly about emotional connection. Peptides like oxytocin remind people how powerful intimacy can be when the mind and body are fully engaged. Relationships often improve because partners feel more open, more trusting, more affectionate, and more connected. Peptides don't replace communication or emotional work, but they can support people who feel closed off or disconnected. As we begin to wrap up this episode, the takeaway is simple. Sexual performance is complex, but peptides offer multiple ways to support it. Whether it's desire, blood flow, energy, hormones, nerves, healing, or emotional connection, there are peptides that work along each of those pathways. They can help men. They can help women. They can help couples. They can boost confidence. They can restore natural desire. And they can support overall wellness. Before we close, here is the next to last disclaimer. This podcast is for educational purposes only and is not medical advice. Always work with a qualified healthcare professional before using peptides. Thanks for listening, keep learning, and stay curious.